At this point, almost everyone you know has probably had COVID. 1 million Americans died from the virus. Millions more made it through.
But chances are you still didn't feel great. Plus, you had to take all that time off work.
Now doctors are warning a new variant means you're more likely to be reinfected, meaning more time off, more feeling yucky, and
if you've had a first infection and you managed to dodge long COVID, having a second infection, you're literally rolling the dice again.
Let's dig into it.
For more than 2 long years, we've been on this COVID roller coaster.
Yeah, there have been the twists and the turns and the ups and the downs, and just when we think we're ready to just coast along with it and live with it,
Not so fast.
Nope.
People are getting infected with a new variant, increasing the likelihood of new health problems. As COVID-19 is surging across the country, Lewis Tucker refuses to lower her guard, especially after seeing her brother suffering with long COVID.
The thing that bothers him the most is his legs and his feet. Just like a tingling, numb, strange feeling in his feet.
With the highly contagious Omicron subvariants, more Americans are reporting second infections. While symptoms are often mild, a new study tracked nearly 40,000 people who had COVID at least twice and found each reinfection creates a new opportunity for serious health risks.
Some people, when they get infected the first time, that infection may weaken their immune system in a way or produce some organ damage that make them more vulnerable to having adverse consequences or adverse health risks.
Dr. Ziad Al-Ali led the research, which found patients with 2 or more infections had more than twice the risk of dying compared to patients with just 1 infection. They had 3 times the risk of being hospitalized and faced higher odds of getting long COVID.
If you've had a first infection and you managed to dodge long COVID, having a second infection, you're literally rolling the dice again.
Actor Hugh Jackman and Health Secretary Xavier Becerra both reported second infections last month. Mississippi Senator Roger Wickert has had it 3 times. A reality check that the pandemic is different now, but it's not over. Now, doctors say most of the reinfections are being caused by the new variant BA.5. It's a child of the original Omicron variant and has quickly become the dominant strain of COVID in the U.S. With the new strain comes new questions. So to answer your top concerns online, here are 3 of the nation's leading experts on coronavirus. Starting with the biggest question, is the new variant worse than past ones? Here's how an infectious disease expert at Kaiser Health and another at UC San Francisco answer.
There are early hints that the BA.5 subvariant of Omicron may be more virulent, so in other words, may cause more severe disease.
Its main superpower is really in reinfections rather than increased transmissibility.
The next question, if you get reinfected with the new variant, are you sick for a longer time? A leading coronavirus researcher at Stanford takes this one.
People are not getting sick for longer, but there are more people getting sick. People that have gotten sick before are getting reinfected.
With the OG coronavirus, doctors said you had about 6 months immunity after catching COVID. But with the new variant, how fast can someone be reinfected after having COVID?
So in the old days, we kind of get a get out of jail pass that lasts about 3 months after acquiring an infection naturally, and people can party like it's 2019 and they feel that way. Not so with BA.4 and BA.5. It's hard to say. You're still going to be a little bit more protected than your average person, but 3-4 weeks after an infection will not be surprising.
So just to be really clear here, you used to have 6 months of natural immunity. Now it's down to this right here, just 1 single month. So how do you protect yourself? Well, you're not going to like this answer from doctors.
If you're really crowded together with people out of doors, I think you're putting yourself at risk. So I would have a good mask on. We are dealing with the most contagious form of this virus. It approaches really measles in terms of a respiratory virus, which is the most transmissible respiratory virus we know of.
All right, well, let's talk about this. Another reason to think about masking up again, the new variant is causing more spread in the triad. 5 counties recently got upgraded to the orange category. That's the highest level defined by the CDC. For now, Guilford County remains in the green, the lowest level. The CDC does not recommend masks for people living in green areas. Now, with more cases popping up, people without their booster might be reconsidering getting that shot. Some people have said that they still want to wait because they expect an updated vaccine to come out. A doctor says you shouldn't delay your booster if you are eligible.
If you're scheduled to get your 4th dose, go ahead and keep that appointment. These updated vaccines won't be out until October at the earliest, and we don't know what the supply is going to be in October. So it's going to be a little while still yet before you can get that updated booster.
Well, she says it's likely that doctors will recommend certain people get an updated booster when it becomes available later this year. Doctors say we need a new vaccine to keep up with all the various variants. Both Pfizer and Moderna say they're working on that updated vaccine. Pfizer released early data about their shot. It says it's effective against newer COVID variants, including that BA.5. The side effects documented were similar to that initial vaccine.
Now, it's not just an updated vaccine. NC State researchers want to develop a new way to deliver the vaccine. They have a team working on an inhalable COVID vaccine. They say it takes effect a lot quicker.
More transmittable strains like BA.5 and BA.4, time is essence. You can't lose 1 day or even 2 days of time to let the vaccine, wait for the vaccine to take effect. It's better to have the effects, immediately after.
Yeah, so many people thought it was so hard to wait that long before they were fully protected. Right now, researchers have only tested the vaccine on rodents. The next step will be testing on a non-human primate before going to a clinical trial with people. The bottom line here is that we might be done with COVID. We might be totally over it, but COVID is not over us.
Oh no, it is not all gloomy though. Doctors work every day, of course, to learn more about the virus, make strides. I mean, so much has changed in the last 2 years. It's something we don't have to worry about as much as we did before.
As much being the key.
As much.